Good evening. I am Jay,
I am Pau.
And I'm April.
and we're going to report the anemia of blood loss. So, there are two classifications of blood loss, the acute blood loss and the chronic blood loss. So, first, let us recall and differentiate the acute from chronic. So, si onset, sa acute, it is sudden. Sa chronic, it is gradual. Sa proliferation, rapid sa acute, slow sa chronic. Sa cells, immature sa acute, and sa chronic, kay mature. So, acute blood loss. Acute blood loss or hemorrhage, it is an excessive discharge of blood from the vessel, whether internal or external, can pose a serious threat to life if medical intervention is delayed. A minor loss generally is not serious and usually does not require blood analysis. Unlike sa extensive blood loss, the physician must assess the severity of hemorrhage through hematologic testing to help determine whether a transfusion is necessary. Many physiologic changes accompany acute blood loss. First, its changes in blood flow affect renal failure flow and cause decreased glomerular filtration and ultimately reduces urine formation. So here, pag decrease ang blood flow, decreased food ang renal blood flow and so decreased food ang urine. So, diri if ang heart, di ba ang heart naga-function properly. So, proper food ang pag-function sa heart paadto sa kidney. So, if ang heart, hinay ang pag-pump, hinay pod ang blood flow. Pag hinay ang blood flow, pag adto sa kidney, gamay ang filtration. And so, gamay lang ang pag-filter. And so, gamay pod ang ma-excrete na urine. So, second, changes in blood flow leading to headaches and confusion. So, here, pag decrease ang blood flow, decrease po ang blood na that flows paadto sa brain. So, causing the brain to, so by that, it caused the brain to deprived of oxygen needed. And so, naga-cause siya og headache and confusion. So next, it does not produce an immediate anemia. So here, why wala siya nag-produce of immediate anemia? So di ba sa atong body nag-compensate naman siya sa atong body. And so wala siya nahulog sa sign and symptoms same as the anemia. Next, a severe hemorrhage reduces an individual's total volume and can be fatal because of the collapse of the circulatory system. Sabotable naman siya, di ba? Na ang circulatory system kay naga-function siya as or naga-deliver siya og blood sa different organs. So kung madaot or kung mag-blood ta o kung mag-severe na ang blood, so dili maka-function ang circulatory system thoroughly. Ngano?
Kato lagi kay nadaot man ang so dili di ba dili nadaot ato ang circulatory system. So wala na siya dili na siya maka-function as normally. So kung dili niya ma-perform yung function, so wala na mag-deliver of blood pato sa different organs. Okay?
Yes
Okay.
po. So, the acute blood loss signs and symptoms. So, there is a percentage of blood loss and the signs and symptoms. So, if 10% ang blood loss, the signs and symptoms may be not at rest, lightheadedness, and increased pulse on arising. If it is 20% blood loss, it causes, or the signs and symptoms may be hypotension and exertional tachycardia. If it is 30%, decreased cardiac output, hypotension, rapid pulse, and cold, clammy skin. If it is 40 to 50%, the signs and symptoms may be severe shock or shock. The laboratory findings, the hematocrit, which is normal, and the hemoglobin, which is normal. Why?
Kay di ba naga-compensate pa man ang ato ang ato ang body. So during the kanang first few hours daw sa blood loss episode, no change pa daw sa ang ato ang hematocrit o hemoglobin. Kay nga naman, kay due to the initial compensatory vasoconstriction, ang iyang blood picture is normocytic and normochromic. Ang platelet and WBC increase pag ang platelets and WBC are increased, and after adequate fluid replacement, leukocyte counts of 30 times 10 raised to 9 per liter are common. Kay nga naman, kay diba, daghan naman ang, kunyari daw, kanang wala na agapan, so naglipas ang pila ka oras, wala pa na agapan, magdikis yun atong platelet kay para mag-stop ang ato ang bleeding o dili mag-reach sa sa hemorrhage. So, ang treatment niya is usually wala jud daw. Pero due to kay wala jud daw kay nga naman nag-compensate naman atong body, nag-compensate gud siya o nag-produce og RBCs kanang mga cells para mabalik ang normal flow. Tapos ginagamitan daw siya og oral iron therapy para warag support lang daw sa mga nawala ng mga iron. Okay?
Okay.
So let's move now to the chronic blood loss.
So, blood cell loss that continues for a long time is referred to be chronic. So, if chronic blood cell loss goes untreated, it will develop iron deficiency. So, since the more na mag-release of blood, mawala ang hemoglobin, so magkaroon din ng iron deficiency. So, chronic blood loss lacks of clinical and hematological features seen in acute blood loss. A noticeable anemia is not usually developed until after storage of iron is depleted. So, at first, ang laboratory findings, normo. Bakit? And then, if chronic bleeding results in an iron deficiency and newly formed cells, microcytic hypochromic. Bakit nag-change? Normo. And then, maging microcytic hypochromic kasi hindi pa siya walang changes na mangyari after 24 hours. But then, kapag lumampas na doon, magkakaroon na tayo ng microcytic hypochromic. Microcytic hypochromic kasi, di ba, nag-release of blood, so mas bumaba ang number ng RBC. So, since nagkailangan na natin ng RBC, more hemoglobin ang kinakailangan. So, microcytic hypochromic.
Microcytic.
So, other chronic problems, we have two examples, hookworm and infestation, occult carcinoma. So, hookworm infestation, since ang ating hookworm nag-reside siya in our upper intestinal, it will consume more blood, wherein mag-cause na siya og chronic blood loss. And next kay si occult carcinoma. Carcinoma, it is so tumor wherein
manifestation of abnormal cells within that lining.
So, di ba, in colon, meron small linings. So, due to infection or tumor, so, mas prone na siya na magisi. So, kapag parang scratches or damage, mag-produce na siya bleeding, wherein it will be causing chronic blood loss. So, lab findings, RBC count, hemoglobin and hematocrit values are decreased after the decrease of serum ferritin. Because since, di ba, kapag bumaba si RBC count, bababa ang hemoglobin tsaka hematocrit. And since nagabase ang iron sa total amount ng hemoglobin, so susunod na din ang baba ng serum ferritin, wherein si ferritin is iron stored.
Yun lang.
And lastly, ang treatment kay oral iron therapy, since nangangailangan naman siya ng iron. That's all. Thank you.
Thank you.
Okay. Away na po. Diyos ko po, mabuang ko po.